Great. So I'm Merrie, and I did my SSC on COVID alcohol use and the effect on a local support group. So, oh, here we go. So basically what that means is I looked at how alcohol use was affected in the UK by the pandemic, and then I did some primary research conducting interviews with members of staff in a local support group charity, which helps people who are struggling with their alcohol use. So just quickly, my methodology. I chose this topic because I was really keen to meet people through the project and understand different experiences. And I was already interested in psychiatry and kind of the human aspect of medicine. So I just started reaching out to local community support groups that I thought might fit that and might be happy to get involved. I conducted, after settling on alcohol abuse, then I did a lit review to get some good background knowledge into alcohol misuse in the UK and how the NHS was coping with it. I went through ethics approval, and then I set up a relationship with one group in particular, which is called Project 6, who are currently based in Mersbrook, and conducted interviews with them. And this was with a view to conduct more interviews with their service users, but unfortunately the project ran out of time. So I'm just going to go through kind of the background to alcohol use in the UK generally. So pre-pandemic, then the BMJ quoted that the NHS is increasingly ill-equipped to address the alcohol epidemic. So before the pandemic began, there was already rising levels of alcohol misuse in the UK, which the BMJ said the NHS wasn't ready for. So it blamed that generally on cuts. So they found £100 million of real-time budget cuts since 2012, which meant fewer people could access specialist treatment, and there was a decrease in specialist consultants. So going into the pandemic, we weren't terribly well placed to deal with any rise in alcohol misuse, which is exactly what happened. So the pandemic accelerated an existing rise in alcohol-related admissions and deaths, found Public Health England. And there's some stats here to demonstrate that from different charities. Public Health England found a 60% rise in drinking at an increased risk level during the pandemic. And also an interesting stat that the Forward Trust found was that a third of patients in recovery when they enter the pandemic then reported relapsing as a result, which I think is quite striking. And one of the major issues in terms of the charities and the support groups that would help these people is that because the NHS was focused on COVID, then this huge surge in cases was hit charities a lot harder because the NHS were having to close a lot of their services that would have helped deal with that rise in cases. So here's a quote from the Royal College of Psychiatrists that says that drug-related deaths and alcohol-related hospital admissions were already at an all-time high before COVID-19. We fear that unless government acts quickly, we'll see these numbers rise exponentially. And looking at how that's going to affect us in the coming years, the Uni of Sheffield did a study which found that they estimate as a result of increased alcohol use in the pandemic, there'll be an additional 200,000 deaths. 200,000 admissions, 7,000 deaths, and that will cost 1.1 billion to the NHS in the next 20 years, which are all quite striking and worrying. So thinking about how this rise affected the charity that I spoke to. So this is obviously on a very small scale. So just to give some background, Project 6 are a charity that people can self-refer to. They also get referrals from GPs and from the NHS, and they offer a really impressive range of services, including one-to-one groups, sessions, therapy, mindfulness, basically like the whole package. It's really amazing what they do. And when the lockdown hit, then naturally they had to go completely online. As I said, then there was a massive surge in patients, and this meant that Project 6 were dealing with triple the number of members as on top of the members they already had. So they were getting vastly more admissions like every single day. And they also had fewer volunteers to help them because they couldn't outsource a lot of the work given that they were all online and at home. So to deal with some of the issues that lockdown brought, Project 6 organised Wi-Fi to be delivered for free for all service users. They also linked up with food banks to send out food parcels, and they redirected their different phone lines to go to senior members of staff's phones, which, while was productive, it meant that there were individual staff members who were receiving calls from directly to their phone number as a referral from a GP, and also redirected from the home from the landline in the office, which meant there were individual staff members getting huge amounts of workload. So yeah, thinking about the staff who this research mostly focuses on. So the main aspects were the higher workload, which increased stress, and working from home. And some of the findings from this are here in red. So one main issue was working at home away from colleagues, which really lowered their support network around them. Also, caring for children whilst working at home and dealing with casework, many colleagues found really difficult. So there's a quote here from one staff member who said, "People on the phone were telling me they wanted to kill themselves, while my daughter was nipping at my trousers wanting to play," which I think is a really powerful image about how these people having to balance such a difficult job with such a human instinct to try and help your child, and while also obviously adapting to a massive social change in the pandemic. Another fact was poor separation and work-life balance, which came up again and again as a challenge for staff. And basically, in summary, the isolation combined with the high workload, combined with always putting themselves second, meant that the staff members that I talked to seemed to get quite poor mental health during the pandemic. And you can see here, one staff member said, "I was focused solely on members. I completely started to forget about me, soaking in all that pain, people threatening with their lives, and I was unable to clear my head. I was locked in," which I think again is quite a powerful description of how it must have felt to be dealing with such a massive workload when you're so isolated. And then some stuff that staff noticed about their own service users was that they felt edgier and more agitated on online meetings, and were less engaged. And also one issue was just practical technical difficulties that meant some members couldn't engage with services because they didn't have the kind of online literacy skills to be able to do that, and that became quite frustrating. Another separate difficulty during the pandemic was that staff members were unable to kind of monitor their members' health physically, which they would be doing if they were coming in weekly, and that as a result, on 2 courtesy calls, then members were found dead in their houses because their physical health had been deteriorating, which is obviously really tragic and difficult as well for the staff to go through and kind of comprehend. So I've gone through a few quotes. If you just want to have a read of these ones, I think they're just quite powerful examples of what the staff put themselves through at the benefit of their own members. Some that jumped out to me a lot were the fact that one staff member said that he felt inadequate because he felt poorly, which is really upsetting, but also understandable. And kind of the idea that he was working hugely long shifts, as soon as he woke up to as soon as he went to bed, he was on the phone or doing casework or doing paperwork for his charity members, and that this was having a negative effect on his own health, and therefore he was feeling in himself that he wasn't doing well, is quite an upsetting idea when it's evident that he's doing massive amounts of work off his own back. So yeah, I think generally it's kind of summarized here that staff were exposed to really high levels of information that was traumatic, and faced with the pressure to help as many people as possible, as there were huge numbers of people coming through the doors, but they did this with really limited resources and numbers. So that's all quite depressing, but here are some successes that they thought about as well. So while the staff found it really difficult, definitely, then there was a huge sense of relief and pride in themselves and their work and their team. And the members I talked to felt really I think, uplifted by the fact that their colleagues had pulled together and done the best work that they could for the better and for other people. And that was lovely to see. And I think they felt also that their own team had become stronger as a result. In terms of practical lessons learned, then there's quite kind of straightforward things like trying to set better boundaries, distributing work better, having a better routine, and also avoiding casework for people who are caring for children. And while I think a lot of these make a lot of sense, I think it's difficult if you are faced with another pandemic. It's difficult to see how you'd avoid some of them. So yeah, I think it would be difficult really, because it is a really hard situation, and that's kind of what my summary is about. So that whilst what they were doing is really remarkable and impressive, it's not a sustainable way to maintain alcohol support services, because at the moment they were relying on really hardworking members of staff to kind of plug the holes where the NHS wasn't coping, and that in reality that charity specifically is going into a funding review, which it doesn't know whether it will receive, as well as a cost of living crisis, and as well as an NHS that's getting more stretched. And this is a quote from one of the staff members that isn't very uplifting, which says, "I can't see an end. It's been one thing after another. I just hope we're here next year," which I think is quite like telling of how he feels about the charity. Just a bit of reflection. So in terms of the practical research, I'm aware that it's very limited because I interviewed 2 people, but I still think it is quite interesting, and I would have thought that their case would be representative of a wide number of charities. And in general, I think demonstrates kind of the precariousness of the systems in place in our society at the moment, in which charities hold a lot of the most vulnerable up, and those charities rely on very few people doing a huge amount of work. So thank you very much for listening, and thanks so much for the opportunity to do this project. I really found it interesting and engaging. Thanks very much.
Yeah, and we have to thank you, Merrie, as well for that piece of work. Yeah, I some of those quotes are you know, go straight to the heart of the matter, don't they, really? And whether after all this work and all this effort, whether they will be continue to be funded, it's like a insult, isn't it, really?
Yeah,
that
exactly.
That's even a possibility. They should be celebrated and enhanced and supported, really. So any questions for Merrie? Carrie?
Well, I absolutely take my hat off to you, because it's just a shocking situation, isn't it? And really grim what people have to put up with, and all the kind of thing of having to fight for funding, and that charities are having to do it, and that it's just disgusting, isn't it? It shows the number of crises. If there was proper investment in proper kind of social infrastructure, it wouldn't be as extreme or as desperate as you've kind of pointed out. And the individual people in the charity who are helping people, they themselves have got really low mental health because of the pressure and the stresses on them. But I mean, I think it's a really, really worthwhile piece of work, and I think it should be put under every local council's nose, and government should read that like tomorrow. I mean, it's a very, very good piece of work for such a short period of time. I really take my hat off to you. There was something else I wanted to say, and I can't remember what it was now. But yes, hats off to you, and I think that should go. Yeah, papers tomorrow, I think.
Yeah, Jack.
Yes, well done. I agree with what Carrie said, and well, to all of you, really, did fantastic pieces of work. I think I mean, you've highlighted the difficulty of the charity that you talked with, but I think it probably applies to all those voluntary sector community organisations. There are a good few people from Darnell Wellbeing here, and I bet people, you were all working, you know, just all that sort of balance of things just was so upset, and people were trying to do their best. And of course, when statutory organisations sort of withdraw, then people look to the organisations they know and the people they know. Anyway, that's me. I wanted to ask you whether you got any sense that the people at the organisation who were dealing with people with alcohol difficulties sort of tried to or used alcohol themselves to cope with the difficulties and the stress and the anxiety, because they, you know, that's what people do, don't they? And obviously you're dealing with a substance that that people do use to help them cope.
Hi, thanks for both your contributions, and also, like Carrie, I completely agree with everything that you're saying. Like, I think it's quite an outrageous display of where our country's at. To answer Jack's question, I didn't ask specifically because I thought it might feel a bit too pertinent. But I know one of the members that I spoke to told me himself that he joined the group after going through alcohol therapy himself. I would have thought he would have mentioned if he'd relapsed during the pandemic, because he was a very open guy. But yeah, I can't really comment because I don't know. And I wouldn't have thought it would be hugely surprising given the stress, but also I think both of them would have said if they had, because they were both being very kindly open and honest with me.
Judy. Gonna have to find that unmute button. How long have we been doing this, Judy?
Oh, I'm going to play the age card right now.
Okay.
Merrie, it just struck me, you know, how the workers that you were talking to, I mean, how much they are key workers, as much as anybody, that the sort of key workers that don't get they don't get recognized, and it just generally you brought something up to
You've muted yourself, Judy. How did you do that?
I didn't do anything. My hands are up here.
Okay.
Oh, don't know when you lost me, but thank you very much. And they're all key workers, I realized, and thinking about the shelter workers at the moment who are out on strike. They should all be recognized equally, in my view. Thank you.
And then the political pressure comes on them not to strike because, you know, outrage after decades of underfunding, they're the ones picking up the pieces and have to do that forever and ever. So, Merrie, you've started a bit of political stuff, which is all good, really. Any other questions, really? And then, I mean, I think for me, one of the things that's come out of this is that this was, I mean, the four of you in turn, the students have to be congratulated for doing somehow or other. It's covered a lot of really important topics in a short amount of time, really. You were with us for a short amount of time, and we've really enjoyed having you as an organization. Certainly individually, I've enjoyed the work that you've done, and been thrilled really to be, you know, to hear now the outcomes of all that work that you've done. So as an organization, we have to thank you. And unless there's further questions, either generally or specifically, I think we can go and cook our tea or whatever we're going to do next.